I don't know if people realize the feelings that you can get when it feels like your personal space or your body has been violated, even if you're just told about that after the fact or you see it in a medical record.
A proposed bill from a Tulsa lawmaker would require hospitals to get written consent to perform pelvic exams on unconscious patients.
It may sound obvious, but research shows medical students have not been getting consent for exams like this for decades. We're taking an in-focus look at this practice in Oklahoma, the new federal guidelines, as well as a proposed state law.
A survey at OU Health in 2005 shows most medical students had performed pelvic exams on gynecological surgery patients under anesthesia, and 3/4 of those students reported they did not believe the patients gave consent for those exams. Some educators and students believe the practice is necessary for those students to develop their skills.
This issue got public attention in 2020 when the New York Times published an article about a woman who had a pelvic exam done by a medical student while she was getting stomach surgery, even though she had told her doctor she did not want medical students directly involved in her care. Then in 2024, the Centers for Medicare and Medicaid Services issued new guidelines that require hospitals to get consent for sensitive exams like pelvic, rectal, prostate, and breast exams, particularly for those patients under anesthesia. So patients should get a consent form that looks something like this one before they go into surgery.
Hospitals that do not follow the guidelines could lose their Medicare and Medicaid funding. But in Oklahoma, they would not be breaking the law. Tulsa Democratic State Representative Michelle McCane wants to change that law. Her bill would prohibit pelvic exams on unconscious patients unless they are medically or surgically necessary or the patient gave written consent. McCain says the last time a similar bill was introduced, it didn't get a lot of traction. She says that's why the new bill is focused on women patients.
I think sometimes it's a little easier to have that conversation about protecting women or children in this way, just due to some of the stigmas around men's health in general. So I'm hoping that if we start here and codify this law this way, or at least start the conversation, that we can then get to a place where it becomes all intimate area exams for everyone.
Staying in focus, a Tulsa father was recently asked to sign one of those consent forms.
But he says it wasn't clear that it could mean he was agreeing for a medical student to do a sensitive exam on his infant son while the boy was anesthetized for an unrelated procedure. News on 6's Eden Jones is live to tell us about that man's experience. Eden.
Well, Greg and Lori, this is a practice this father didn't know many healthcare systems do, but he hopes people become more informed on exactly what they're signing at the doctors.
Robert Norman is the father of a 6-month-old boy who had an appointment for an MRI last week at St. Francis Hospital in Tulsa. He says everything was going great until the paperwork.
There was just a consent form that raised some questions with this, talking about sensitive procedures being done by students or residents.
This consent form asks permission for medical students, residents, or others to be present and to perform procedures on unconscious patients for educational purposes.
That first part related to the surgery is great, but then they separate it and there's like examinations or invasive procedures for educational training, and that's where the wording got weird for us.
At first, Robert was going to sign it, but then he asked more questions. He learned those procedures might be unrelated to the appointment.
The clarification was no, it was, even if it's not indicated, they may practice these sensitive procedures, and by sensitive procedures, it's a digital rectal exam, pelvic exam.
He denied consent and felt the form wasn't clear enough.
I'm definitely a proponent of students participating and being there. However, when it's, concerning a sensitive procedure, and especially one that's not indicated for the procedure, is when we had an issue with it.
Robert says his experience highlights the importance of providers clearly explaining consent forms.
I think they just need to do a little bit better job of explaining those things to people before they sign them, especially when the wording's confusing, especially when it concerns such sensitive procedures.
Now, Robert says St. Francis Hospital has since contacted him. They also sent us a statement saying they understand the form may cause confusion, but they are committed to training their staff on how to clearly explain it. Lori?
All right, Eden, thank you. Representative McCain says along with the legal forms, hospitals should make sure the language is understandable to patients. The next legislative session begins February 3rd. We do have more information on this story, including the full interview with Representative McCain, as well as statements from local hospitals about the federal guidelines. You can find all of it at newson6.com.